In this webinar, we shall learn how to feed and how to monitor for feed intolerance in low birth weight infants. The preferred initial feeding method in low birth weight infants is decided by their feeding skills. Roughly, the feeding skills correlate with gestation and with birth weight. As a rule of thumb, any baby with birth weight less than 1200 grams is initially started on intragastric tube feeding. Babies weighing between 1200 and 1800 grams are started on spoon or palatal feeds, while those weighing more than 1800 grams are given direct breastfeeding. But these are only rough guidelines. A baby with birth weight of 1700 grams may be able to feed directly from the breast, in which case there is no need for spoon feeds. All low birth weight infants should ideally be on direct breastfeeding by the time of discharge from the hospital, irrespective of the initial feeding method. They must be assessed periodically to check if they are ready to accept breastfeeding. For babies on intragastric tube feeds, the feeding readiness should be assessed daily. If ready, they must be offered small feeds by spoon or palatal. If they accept well, the amount by spoon can be slowly increased to reach full palatal feeds. Babies on full palatal feeds should be put to breast daily. They should be assessed for effective sucking at the breast. If they can suckle effectively for adequate time, direct breastfeeding should be initiated. Babies on any mode of feeding, including intragastric tube feeding, should be assessed for adequacy of feeding on a regular basis. If the baby is on spoon or palatal feeds, adequacy of feeding is indicated by the following criteria: baby swallowing milk without cough or spluttering, and baby accepting the required amount of milk. Babies on breastfeeding are said to be feeding adequately if they can attach well and suckle effectively, and they can suckle long enough to satisfy their needs. For all modes of feeding, other indicators of feeding adequacy include adequate weight gain, that is 15 to 18 gram per kg per day after 7 to 10 days of birth, and passing urine at least 6 times in 24 hours. All low birth weight babies should be assessed for feed intolerance by careful inspection of the abdomen before each feed. If there is obvious abdominal distension, the stomach contents should be aspirated to check the nature and the volume of aspirate. If the aspirate is clear but is more than 5 ml, the feeds should be withheld for 1 to 2 feeds, after which we should reassess by abdominal examination. If there is no distension, we can restart feeds. If there is distension, we should aspirate again and then decide. If the aspirate or vomit is bile or blood stained, feeds should be withheld for 24 to 48 hours. These babies should also be evaluated for local and systemic causes like NEC. We can restart feeds after 24 to 48 hours depending upon the abdominal and other systemic examination findings. Thank you.